Well, hello, Philippine Nurse followers. How are you all doing? We hope that you're all doing well. It's already mid-April, the middle of Lent season. Lent season is almost over, actually, and time is flying so fast. I know that you're all busy, so thank you for taking the time to join us. As you know, Philippine Nurse is brought to you as a public service project by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. Well, some of the board members of the PNANV traveled to Reno last weekend to attend some important functions. They attended the High Hat of Tea event for the NNF, or the Nevada Nurses Foundation, and they had a meet and greet for prospective members of the PNANV. This event was hosted by Marie Costas and Dr. Virginia Squire, our BODs who are in northern Nevada. And during these events, they met some of UNR, or the University of Nevada, Reno, nursing students from the Orvis School of Nursing. It is amazing to note that the Student Nurses Associations, or what you call the SNAs, in the School of Nursing have student nurses associations, and these associations are listed as resources for the nursing schools. The SNAs have many different roles and activities to engage the nursing students and the community as well. So today we have invited two of those nursing students to talk about the ever-changing dynamics of student nurses, the different roles and the activities of SNAs, and the important activity that they want us to share called Nurse Unseen. So please welcome via Zoom from Reno, Mr. Anthony Ponticello and Matt Curimao. Welcome, gentlemen. How are you?
Hi, Doris. Thank you for having me.
Of course, of course. And Matt, can we hear you there?
Loud and clear, so thank you as well for inviting me.
Oh, of course, of course. Well, thank you so much for actually, joining us today. Let me just say that Mr. Anthony Ponticello, let's do him first. He is half Italian and half Filipino, right, Anthony?
Yes, that's correct.
Okay, he is currently a level 2 nursing student at UNR, Orvis School of Nursing, and he serves in the Student Association as a member of the fundraising committee. And in this role, he helps to generate funds for the Student Nursing Association through fundraising initiatives and charitable campaigns. And you were originally from Las Vegas, correct? And then you returned to UNR to complete your BSN degree. Well, welcome, Anthony. And
thank you.
Good. And do you have anything to add to that?
Yes, I originally was working in public health. I was leading health promotion efforts during the COVID-19 pandemic. And ultimately, those experiences, they inspired me to take action and directly serve those communities through nursing practice. And so my nursing education, my nursing practice is informed by my public health experiences and the upstream global perspectives of public health. And I seek to improve nursing for all communities by advancing health and wellness for all populations.
Well, very good. I'm so glad for that. You young people can take over this older generation. Just kidding. But anyways, thank you for joining us. And of course, we have Mr. Matt Joshua Curimao. He is currently a level 2 nursing student at UNR as well, and he is full-blooded Filipino. He has many roles as a pre-nursing liaison, DEI or committee member, and a level 2 curriculum committee student representative for the Student Nurses Association of Orvis School of Nursing. He uses his position to connect with potential nursing candidates and to champion their causes, especially those who are underrepresented. Anyway, is that correct, Matt? Oh, we can't hear you.
Sorry.
Oh, good. Yeah, go ahead.
Yeah, so that is correct. And I plan to use my time in UNR in Orvis to help mobilize their resources. And hopefully, by the time I would be graduating, it would be a place of nurturing and support for future nurses, and of course, our wonderful community up here in Northern Nevada.
In Northern Nevada. Yeah, I love it up there. Well, thank you very much, gentlemen, for joining us today. And so I'm going to shoot off some questions to you guys. Okay, so can you tell us about the UNR Orvis School of Nursing? And both of you can respond.
Sure, I can answer that question first. Orvis School of Nursing is housed at University of Nevada, Reno. They are the oldest school of nursing in the state, and they have a long-standing history of nursing leadership and excellence. They're very well connected to healthcare community up here in Northern Nevada, including renowned Northern Nevada medical system, among other care providers. And recently, the Orvis School of Nursing was distinguished among all the nursing schools in the nation with the highest NCLEX pass rates in the nation.
Wow.
Which is a huge accomplishment.
That's awesome. I didn't know that. Okay,
Yeah, it's very exciting. It's number one out of all the schools that have nursing students graduating to take the NCLEX, which is the RN licensure exam.
Right, right. Matt, do you have anything to add to that?
Definitely. The school itself is committed to excellence in teaching, research, and service. Basically, what we're aiming to have are nurse leaders to promote health and well-being within the diverse populations, because Reno is so situated in a unique position that it's close to West Coast, and it's a gateway to to other states. It has that distinct position of helping out different parts of the population, whether it would be older veterans, younger people, and everything else in between. So we do have very unique health issues that need to be addressed here, and that gives us a unique experience on how to present solutions to these.
Very good. Well, thank you. And from what I understand, the Orvis School of Nursing is the oldest nursing school in the state, right? Committed to health care for the people. Is that right?
That is correct.
Good, good, good. Okay, so the UNR Orvis Student Nurses Association, or OSNA as we are going to call it, is listed as one of the resources for student nurses. So with you being members of the association, what are the goals of OSNA?
So some of the goals of OSNA are to connect all the nursing students with faculty and practicing nurses here in Northern Nevada and across the state. So OSNA aims to provide support and networking opportunities specifically to those students, and then also enhanced leadership potential. So we also connect with other nursing professional organizations, such as the NNA, or National Nurses Association, as well as PNANB, Philippine Nurses Association in Nevada, and other nursing professional organizations as well.
Very good. Matt, anything to say?
Addressing our nursing students' needs, especially here in Reno. there is food insecurity, and a lot of our faculty have seen that, and they have started initiatives such as food and pantry supply, mental wellness within all levels. We have we've partnered with You Will to help with our students with their mental health. Our faculties always champion taking care of yourselves, because you need to take care of yourself first before you can take care of others. And
Exactly.
that's what we're going to be segueing into today as well.
Yeah, exactly. And that's actually one, we have a program at PNANV called mental health program called Ako Muna, meaning me first. So you got to take care of yourselves first, right? Good.
Absolutely.
Yes, yes. So I know that there are several different committees in OSNA. What are those committees, and which committees do you belong to? And can you explain your roles with OSNA? You first, Anthony.
I'll explain a little bit about the committee structure in OSNA. We have several committees focused on different goals of our organization. I belong to the fundraising committee, and so my goal is in this committee is to lead fundraising initiatives and charitable campaigns to mobilize resources for our nursing students. And so recently we hosted a fundraiser through Krispy Kreme Donuts.
Ooh.
The exciting thing about this fundraiser is that it was actually across the entire United States. It was nationwide. And through purchasing donuts through a particular link, folks were able to generate funds that went back to OSNA. And our campaign was very successful. We sold over 50 dozens of donuts.
Wow.
All of those purchases, about 50% of the proceeds went back to the Orvis School of Nursing Association.
That's
Which is where we
great.
support our students with the food pantry and different events that we put on for the nursing students' benefit.
That's good. What about you, Matt? I can't hear.
The fundraising committee, we also have community outreach activities, faculty liaisons and liaisons for each level of our students. We also have liaisons for the Northern Nevada clubs, the OSNA. For me, I am specifically for pre-nursing, because I felt back then that we didn't have any visibility within our campus, which is ironic because pre-nursing is the largest population of the student census, but you would never see any nurses going around the campus. So that's something that I'm passionate about, to raise awareness that for these future nurses, I'm there for them. We're there for them to help them go get, basically demystify being a nurse, seeing the pros, seeing the cons, seeing if it's right for them. So that's pretty much what our committees entail, including streamlining the curriculum, see what works, see what doesn't work, we reevaluate, and then we assess, and we'll basically improve as we go.
Very good. And I think you also have a web committee, right? Who's in charge of your social medias. Is that right? You do. Well, we can't hear you guys. So anyway, I was reading on your website, and there's even an apparel committee. What is that all about?
The apparel committee, I believe they design shirts and merchandise for sale to
Uh-huh.
support the Orvis School of Nursing.
Okay, that's good. So, Anthony, I know that you attended the meet and greet event of the PNANV. What do you think of that event and the PNANV?
Well, it was very exciting to be able to attend PNANV's Northern Nevada meet and greet event. I've been a member of PNANV for several years now as a pre-nursing student and now as a nursing student. But unfortunately, we have not had too many opportunities to connect with our kababayan down in the south, and there's not as many networking opportunities for Filipino Americans up here in the north. And so this was my first exposure to a PNANV event up in Northern Nevada. And it just gave us a great platform to really connect, share our struggles within healthcare, share our stories, and to learn from each other. And I feel like now we're more united as a community after this event. And I also was able to spread awareness about our upcoming documentary screening.
Very good. And yes, we are relying on you guys up there. We do have two board members that are up there, Dr. Squire and Marie. And so we're hoping that, by some of our president was there, Emer Sambo, and of course, Lisa Gamboa was there too. You met her and you met them. And so we should be able to hopefully, create more awareness to the Filipino American community, especially those who want to come to nursing, right?
Yes, definitely. It's exciting to see PNANV. They've been such a leader in the health promotion efforts down in Southern Nevada, but to see them now step into this role up here in Northern Nevada as well, it really positions them as statewide leaders and representatives for Filipinos in nursing across the entire state.
Very good. Very good. We're excited about that. So, Matt, you are a member of the DEI committee of the School of Nursing. Can you tell me about that program, your thoughts, and your role or your part in the committee?
Absolutely. Yes, I am part of the Diversity, Equity, and Inclusion Committee at the Orvis School of Nursing. We focus more on promoting a supportive and inclusive environment for all students, faculty, staff, regardless of their orientation or their beliefs. We try to advocate for policies that enhance diversity and equity. We participate in educational programs and we support initiatives that address health disparities. The biggest issue right now also here in Northern Nevada is usually mental health. Also with the current climate, with the policies regarding DEI, I felt that we stepped into something that is timely, that we can basically, because of the DEI, back then we were on the back burner. But I feel now that since there's this buzz about DEI, whether good or bad, we feel that we can use this as leverage to basically include everybody to the conversation. What is DEI? Is it something good? Is it something bad? And how it affects you, how it affects everybody else. And we want to make sure that we send out the message that it is that aligns with the values that we have in UNR to include and strengthen everybody in our community.
Well, I'm glad about that because, yeah, like you said, it is a little bit a sensitive issue given the current political climate. But I am just glad to see that UNR has not taken that away. It's still on your website. So I'm glad we're still talking about it and the continued, we still need to continue making people aware that this is an important issue, right?
Exactly. And I believe it is our prerogative to continue the conversation because let's face it, it will never go away. People are different,
Yes.
and that what makes us unique. And I think everybody can bring something to the table, and I believe everybody should have an equal share of their opinions and voices.
I totally agree with you. Well, thank you for that. So, both of you, what are your thoughts about the nursing programs offered at UNR? What strengths do they have? And do the students have adequate resources to help them?
I think Orvis School of Nursing is an excellent nursing program. I returned to UNR specifically for this program to obtain the BSN degree. And I think just given the history and also the recent changes at the Orvis School of Nursing, we are really leaders on the campus for diversity, equity, and inclusion and community representation. And also, as future nurses, I think there's just so much leadership at the school, and it really is exciting. There's been recently some curriculum changes within the Orvis School of Nursing that have benefited the nursing students. As a result of policy changes during the pandemic, getting a little into the weeds here, but recently they increased the class size, they restructured the program to better support the students. We're focused on not just academic success, but also professional success and mental health and well-being. And also, we are really focused on serving all of our communities in the state. There's a big focus on the social determinants of health and power disparities within healthcare, so that we're adequately serving marginalized communities. And I think all of these changes recently really benefit the nursing students and equip us with the knowledge and skills we need to better serve our diverse communities here in Nevada.
Great, great. Now, Matt, I know that you specifically came from Hawaii, right, to UNR to finish your BSN as well. So tell me about, are the programs good? I'm sure, right?
By saying I came from a traditional BSN course in the Philippines. So coming into UNR, was a very interesting experience because I felt when I was in the Philippines, getting my education, it was all about learning by rote. Basically, you're given a lot of information and you just have to do the motions and hopefully the rationale comes later. The thing with Orvis is you have very passionate educators, you have very passionate leaders that they explain to you the why of why you're doing your why are you using evidence-based practices, why are you championing for patient advocacy, why you should always be mindful of what you are doing, and also to see beyond what you have and look at the powers that be that will affect your job, that will affect basically how you would take care of people. So having that exposure in Orvis is very illuminating, and it is inspiring. That's why I could tell that most of my faculty members are my inspiration for, standing up for myself and standing up for fellow nurses.
Very good. So it sounds like you all the nursing students have adequate resources that they need, correct? Yes.
Yes, that's correct. There's been such a strong focus on not just, your academic success in the program, but also the resources you need as a student to succeed, whether that's tutoring support, the food pantry support, as mentioned by Matt earlier, or mental health support. We recently partnered with the You Will program, which offers mental health services for students and free therapy. And so there's this big component of the nursing education that focus on holistic wellness.
Very good. We need to invite them to talk about it, and maybe the two of you can co-host this program. So that's great. And tell me what a level 2 nursing student is. And I know, Anthony, you're graduating this December. And what about you, Matt?
On the same cohort, so we are going to be graduating together.
All right.
Mhm. So level 2 usually is we're learning a bit more about our scope. Currently, we are focused on mental health nursing and medical surgical nursing. So two very challenging areas of nursing, and it is something that is very heavy, especially for the curriculum. Right now, we are also getting feedback from some of our students, what works, what doesn't work. And for me as a liaison, I present it to our faculty to see if there are changes that we can do to improve our course materials. So it's always ever improving, and they're very proactive with the feedback that they're getting from the students in order to make it so that we learn better and not just be book smart, but be actual compassionate nurses in the future.
Excellent. Excellent. Wow. That's wonderful, and that's good news, actually. So I was going to say that both of you are now currently involved in a project, and it's the screening of the documentary called Nurse Unseen. Now, we're going to have a little trailer that we can pause and show a little later, but before that, can you explain what this documentary is all about, and why do you think it is important that we share it?
Yes, I'd be happy to answer that question. So Nurse Unseen is a documentary film that was created by director Michelle Josue and director Carlo Valayo. They created this documentary to explore the stories and experiences of Filipino nurses during the COVID-19 pandemic. As many people are aware, our Filipino American community and Filipino community in general, we are so overrepresented in healthcare and in specifically nurses. But for so many years, our stories, our experiences, our community's history has not been told and has not been shared. So this documentary is really groundbreaking because it explores and brings those issues to light.
Yeah.
Very good. So let's pause here a little bit and let's insert the trailer for Nurse Unseen.
We all left the Philippines.
My mom wanted me to become a nurse.
She said if you choose nursing, it'll be easy to go to the United States.
Go to America. It's the land of milk and honey.
We wanted a different life, and this is where we chose to go.
When you walk into any hospital, you're going to see nurses that are Filipino.
Without Filipino nurses, the U.S. healthcare in many cities would not exist.
They're in emergency rooms, in the ICUs, in disproportionate numbers.
When it comes to nurses who are dying from coronavirus, nearly a third of them are of Filipino descent.
I didn't know how deadly this virus was, and I don't think my mom knew either.
Is this it? Is mom gonna die?
Filipino American healthcare workers were putting their lives literally on the line. I look at my patient and say, fight, you have to fight. I'm here with you.
You see a patient that goes from worse to recovery, and you know that you made a difference in someone else's life.
Filipino nurses have been in the United States for decades. You cannot take Filipino nurses for granted anymore.
If I am seen, it means that I matter, that my contributions are appreciated. We have to continue telling our story. We have to be seen.
Well, that was really inspiring. We all know that, it makes you take a look back, really. We all know that when you go to any kind of nursing any kind of healthcare facility in Nevada, or even in the United States for that matter, you would see that at least half of the people, half of the nurses are, Filipinos, Filipino Americans. But, it looks like we're the silent majority. So I'm so glad that we're now putting this in the forefront, especially in the Reno area, because we did have that screening down here in Las Vegas, and I'm so glad that you're taking this on. So why is cultural representation significantly important in healthcare and education? Matt, you want to take that on?
I think to put simply, being represented basically lifts everything up. Healthcare becomes equitable. It improves everybody. What we're going to be doing is, if we're pigeonholing certain parts of our population, it's never going to improve, and we are only as strongest as our weakest population. So everybody who is underrepresented, we're not going to improve as a community, and you will see like there would be failures in a lot of failures in care, and we can see that. COVID basically exposed that systemic deficiencies in our system that we basically crumbled during the 2019-2020. And we can see that there was a huge disproportionate amount of Filipino nurses that were affected at that time. And a lot of them were pretty much forgotten.
Yep.
And I think, as much as we just saw the statistics, we just saw numbers, we got to remember that, it's someone's father, it's someone's mother, someone's sister, someone's brother at that time. And it's so easy to forget, but remember, behind those numbers, they were people.
Yes.
They were loving people. They dedicated their lives to nursing. They dedicated their lives to helping other people in need. So we don't want to forget that humanity.
Yes.
That we are here, we are still serving, and we want to make sure that we change for the better.
Yes, yes. And I totally agree with you. From a personal standpoint, I can share that I was then the president of PNANB during COVID time. And we did all kinds of, we sewed masks, we sewed, we did face shields only because they were lacking. I work in the home health field, and there was no direction whatsoever as to how we are going to take care of ourselves and the patients as well. So that being said, do you have any kind of personal stories that impacted you during the COVID time, you and your Filipinos? Oh, I forgot to tell you that we actually started a prayer group for, the people that were catching COVID. And I was part of the prayer group, and the list started getting longer and longer and longer for those who you wanted to say a prayer for. And mentally, I honestly could not handle it. I could not handle it. I had to drop off that prayer group. So it personally affected me. And so I'm over it now. But yeah, I just want to know if you had any personal impact, stories that impacted you as well. Anthony, you have any story?
Yes. Thank you for sharing so much about your experiences, Doris. That's very insightful. Yes, I'd love to share some personal examples of how all of it connects. For example, I recently learned that I have hypertension, aka high blood pressure. And in nursing school, we learn how hypertension or high blood pressure can elevate by risk for congestive heart failure, thrombotic events, and other, adverse health consequences. But something that I didn't learn until I looked more into the research was that Filipino Americans, we actually have the highest rates of high blood pressure out of all Asian Americans. And our rates of high blood pressure are actually on par with the Black or African American community. And this is an example of a disparity that, is currently unheard. It's not being recognized or really shared. And the same thing happened during the COVID-19 pandemic, where people knew that Filipinos were impacted here in the US and around the world, but a lot of people did not really realize that 1 in 3 nurses that passed away during the pandemic were of Filipino descent. And many people didn't realize this because the widespread American media was not reporting it. Our community was not really represented in the research, and public health was not advocating for us. And so ultimately, as healthcare workers and as nurses, it's our responsibility to take the lead and to share this information with the community, because we are the voice of healthcare in our own communities.
Well, thank you for sharing that, Anthony. Yes, absolutely. What about you, Matt? Do you have anything personal to share?
When I was in Hawaii, I was working as a medical assistant for a vein clinic. So I was working with a lot of vascular issues. And it was a hard awakening that time where, and I learned this from my my nurse, is don't be a hero. Which is ironic because if I remember back then, the slogan was everybody was a healthcare hero. So it was rough because we were basically close with a lot of our healthcare workers, nurses, respiratory techs, everybody. But because of COVID, and nobody actually had any answers on how are we going to handle this.
Yeah.
We were pretty much left to fend off for ourselves. And
Correct.
We can go on, especially with Hawaii, because there were different policies per island.
Wow.
And it brought some confusion. And unfortunately, now in retrospect, a lot of the policies that were enacted cost a significant amount of lives.
Yeah.
But like I said, that's another another story.
That's another story.
Yeah, that's going to be another story. But for me, that's where I learned how, with the doom and gloom around us, you would still see how everybody's still helping everybody.
Yes.
A lot of the titos and titas would bring me food.
Yes.
And because there were no public transport, I didn't have a car in Hawaii, which is really bad. But you would still see that sense of
bayanihan, so to speak.
Bayanihan, that
Correct.
they're bringing food, they're bringing water, they got a respirator from Home Depot.
Oh my gosh.
Yeah, we were using respirators from Home Depot, and it's something beautiful, but it's also that's very tragic that it took a pandemic to see how Filipinos are helping the community, how we were always on the background helping out people. And that's something that we don't want to fade away, that, we want to make sure that we leave our mark. And as Anthony mentioned, it is very disproportionate. A lot of the Filipinos were literally unseen.
Yeah, and that's why the title of the documentary is Nurse Unseen. It's true. I know that I think what's the percentage? I think 4% of all those who died were Filipinos. I think it's higher, isn't it?
I believe so. I remember with the National Nurses United, I think this was during the 2020. I think of the 213 nurses that died, 67 were Filipino.
Wow.
So we made up the largest non-white ethnic group of nurses to die from COVID.
Yeah, and I think there is a reason for that. My opinion is that most of us work in critical care and all those specialized units. And so those units were who received the COVID patients. So
I think it connects to that don't be a hero thing, because for me, most of the titos and titas that I know who passed away from COVID in Hawaii were picking up shifts because, hey, everybody's sick, but someone needs to take care of all the sick patients. So they were picking up shifts, especially when, even though it's isolated, they have all the isolations. And I think ultimately that selfless behavior contributed to a lot of deaths in our community. And as with Filipinos, we are very family focused. We are very caring. Unfortunately, they try to do what needs to be done.
Right.
At the cost of their lives, unfortunately.
Well, thank you, Matt, for that. Now, initially, Matt, you wanted to talk about this, but I'm going to throw this question at you, both of you. So, as you know, this is a complex subject that deals into various intersections, such as, historical content, cultural significance, and looking at the implications for both policy and practice. So, how can we as healthcare workers influence the narrative to call for equity and continue this conversation? Who wants to start?
I can respond first.
Sure.
I think that as Filipino Americans, we have a responsibility to speak up for ourselves, which can contradict sometimes with our bayanihan spirit and focus on others first. I think we can learn to also prioritize our own needs and speak up for the health and wellness of our own community. For example, this is very pivotal because in Nevada, Tagalog is actually the third most commonly spoken language, and Filipino Americans comprise the largest Asian American group within the state.
Minority.
And so for these reasons, we are very represented within the population of Nevada, within healthcare in Nevada. However, our stories and our experiences, they're not adequately being shared accordingly. And what I mean by that is our community's history is not included in the history books. People do not learn about the Spanish-American War, the Filipino-American War in history books. They don't learn Tagalog in school or even have access to it. It was only last year when UNR decided to include Tagalog in its world languages program. And so due to this lack of representation within academic spaces and within education, it really stunts a lot of people's knowledge and awareness about who are Filipino Americans and what is the Philippines, where is it. People just don't really have any understanding. And so I think by pushing forward these efforts, educational opportunities such as Nurse Unseen, we're able to spread awareness about our community health issues, and ultimately improve the health disparities for our community across the state.
Very good. Well, thanks for that, Anthony. What about you, Matt? What's your thought on this?
It's to challenge the disparities and the harmful myths. If anything, what also COVID has shown us was hate will always be there. And this was very prevalent back then in San Francisco with the Asian American hate. There was and even up until now, it's flaring up for hate crimes against Asian Americans. So it is important to challenge that myth that, it just because you're an Asian American doesn't mean you spread COVID. And what it is we need to challenge that. We need to amplify the voices. We need to make it louder for everybody who it was underrepresented at this time and even up until now. And I agree with Anthony that we need to share their stories. We need to be louder to promote that equity. We're Filipinos. We're always shy. A lot of my patients would always tell me, you don't speak up because you kind of have such a soft-spoken voice. I think that as a collective, as a Filipino collective, we are very sweet, but we do need to tap into that that righteous indignation that we should stand up for what is right.
That's right.
That includes and that includes standing up for our rights, whether it would be for fair staffing, safe workplaces, and making sure that we take care of ourselves, that we do not repeat these tragedies that we just experienced.
Yeah. Well, both of you, thank you so much for your insight on that particular question. So when is the screening of A Nurse Unseen? I believe we have a flyer that we can put up on screen. This is going to be on April 29th?
Yes, that's correct. We hope to host it on Tuesday, April 29th. Starting at 5 p.m., we'll have a short networking, 30 minutes, and then the screening will start at 5:30. Following the film screening, we are hosting a discussion panel as well.
Okay. This is going to be at the William Pennington Health Science Building, correct?
Yes, that's correct.
Okay, and we're flashing actually the flyer on screen, and there's a QR code there where people can RSVP. So there's still room, right?
Yes, there's still room to register for the film screening and panel discussion. We're very excited, but unfortunately, we do have limited space available for this event.
Oh.
So it's very important that folks that are interested take action to register as soon as they can. We're also going to provide nursing CEUs for our nursing populations there who want to renew their license, as well as serving appetizers and desserts.
Nice.
We'll have lumpia and some other great Filipino foods. So we're really excited to bring this event, not only as like an educational event to the campus, but also as an opportunity to spread awareness about diversity, equity, and inclusion, really share our culture with the Northern Nevada community.
Right. Good. Very good. So everybody, Nurse Unseen, the screening will be on April 29th in the Reno area at UNR, the William and Pennington Health Science Building. So if you can, please RSVP to the QR code on the screen so it'll reserve your place. So we hope that you will be there. Okay? Thank you. And finally, I'd like to ask the two of you, what is your message to the nursing students and the nursing community? Anthony, you want to start?
Yes. So I think as nurses, we have such a powerful role in shaping the health and wellness of our community. I would say my takeaway is embrace learning as an adventure. There's so much that we still don't know that we don't know about health and wellness and how it's impacted by our community's history, colonization, the different levels of oppression, historical trauma. There's so many layers that we are just beginning to unravel about how marginalized communities are impacted by all these different layers. And so it's exciting to embrace this adventure and to continue learning for the health and wellness of our communities.
Well, thank you, Anthony. And Mr. Matt?
Kind of person to be not everybody could be a nurse, but if you do plan to be one, stay committed to your education and develop yourself every time. And there will be people that will help you. And we want to make sure that we embrace our diversity. We celebrate everybody. And if you see something that doesn't feel right, don't be afraid. Advocate for, what is right. Advocate for equity. And always support each other. Just be kind to everybody. Be kind to yourself. Be kind to even sometimes when your patient is a bit irate. Remember, we're here to care.
Yep. You are so right about that. So, gentlemen, thank you so much, Mr. Anthony Ponticello and Matt Curimao, for joining us today. We know that, just so you know, that we are very proud of you and thankful for your engagement activities for the nursing students and your passion project, which is the screening of Nurse Unseen. So thank you so much. And if you have any other issues or questions or any topics you want to discuss, just let us know. And please come back to the podcast, okay?
Thank you so much.
You're welcome. And to our audience, we leave you with this. Student nursing associations are important because they offer professional development resources, networking opportunities, leadership roles, awards and scholarships, advocacy, and involvement in policy making. As nursing students, you can also join professional nursing organizations that allow students to be members, such as the PNANB, where benefits can be shared. And just to recap, Nurse Unseen is a look at the history of the American medical system that would be incomplete without a look at the Filipino nurse. Nurse Unseen is a history in a documentary that highlights the contributions of Filipino nurses to the American healthcare. There are significant issues that Filipino families faced and suffered in COVID. And there is so much sadness and loss that has not been, that will be underscored in this movie. So, of the women and the families who sacrificed so much over the years to come to the U.S. and work in the hospitals here. So thank you so much for joining us today. Please be safe and be well. Until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.
just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio.